My name's Wendy, and this is my head-to-toe assessment. This is my patient Matthew. He's a 19-year-old white male, neatly dressed, well-groomed, sitting in a calm, relaxed manner, head held in an upright position. First, we're going to check the head, palpating the scalp for any masses or pain. Do you have any pain?
No.
Okay, there is none. Next, we're going to look at the face. Will you please raise your eyebrows? Okay, he raises his eyebrows equally, and his facial expressions are symmetrical, showing that cranial nerve 5 is intact. We're going to look at the ears. Note that the tips of the ears are equal with the outer canthus of the eyes, and they are symmetrical. We don't have to check tympanic membranes as we check that in class. Next, we're going to check the eyes for perla. Pupils are equal, round, and reactive to light, and we're going to check accommodation now. Look at the tip, please. And eyes are accommodating. We're also going to check the 6 cardinal fields of gaze. Checking the 6 cardinal fields of gaze shows that cranial nerves 3, 4, and 6 are intact, and they are. We're going to look at the nose. The nose is centered in the middle of the face, as it should be. It is symmetrical. The septum is not deviated. We're going to palpate the frontal and maxillary sinuses. Do you feel any pain or tenderness?
No.
He feels no pain or tenderness. Next, we're going to look in the mouth. The mouth is symmetrical. Please raise your tongue. Okay. The tongue, mucosa, and the gums are pink and moist. The uvula and tongue is midline. The tonsils were noted bilaterally and they're not swollen. And when he raised his tongue, the parotid and submandibular glands were noted, and they were also not swollen. Next, we're going to check the lymph nodes in the neck. The lymph nodes are palpable and movable, and they're not swollen. We're also going to check the thyroid, and it is palpable and not swollen. Next, we're going to ask the patient to turn his back to the camera, and I'm going to listen to the lung sounds in the upper, middle, and lower lobes. Okay? And lung sounds are clear in the upper, middle, and lower lobes. No abnormal breath sounds were noted, and he has a respiratory rate of about 16. We're going to check for CVA tenderness. Do you have any pain?
No.
He has no CVA tenderness. Turn back to face me. Next, we're going to listen to his heart rate. We're going to listen to the apical pulse at the midclavicular line, the 5th intercostal space. Okay. S1 and S2 is noted. No S3, S4, murmurs, or gallops. And he has an apical pulse rate of approximately 82. Next, we're going to check the abdomen. When looking at the abdomen, you check in the order of look, listen, and feel. So first, we would look at the abdomen to see if there's any masses, distension, anything noted just by looking at it, and there is none. Then we're going to listen to the bowel sounds in all 4 quadrants. And he has bowel sounds noted in all 4 quadrants. Third, we're going to palpate, see if there are any masses or distension noted upon palpating. There is none. You have any tenderness while I'm palpating?
No.
He has no tenderness. Next, we're going to look at the skin. The skin is warm and dry to the touch. The texture is smooth, and there are no abnormal scarring noted. We're going to look at his nails. The nail beds are pink, nails are well groomed, and capillary refill is less than 3 seconds. Next, I'm going to ask the patient to close his eyes. And I'm going to put this object in his palm and ask him to identify it by touch.
It's a perfect look.
And that is correct. And I'm also going to write a number on his palm and ask him to identify the number.
3.
And that is correct. Next, we're going to check the pulses. We're going to check his radial pulses bilaterally. And they're noted equally. I'm going to ask him to squeeze my hands. And the strength in his palms are noted equally. There are no problems. I'm also going to ask him to raise his arms against the resistance. And his muscle strength and tone in his shoulders are normal. I'm going to ask him to extend and flex his elbows. He has good range of motion in his elbows. I'm also asking him to rotate his wrists. And he has good circumflexion of his wrists. We're going to move and do the same things to his lower extremities. Noting the pulse rate first. And he has bilateral pedal pulses. I'm also going to ask him to raise up against my hands. And he has good strength and muscle tone in his feet. And I'm going to check his Babinski reflex in his foot. I would check the patellar reflex, but his feet aren't dangling, so we can't check them at this time. I'm going to ask him to extend and flex his knees. And he has good extension and flexion of his knees, and I'm going to ask him to rotate his ankles. And he has good circumflexion of his ankles and good range of motion in the lower extremities. Next, I'm going to ask him to walk across the front and then back to his chair. He does not have any gait or balance disturbances. Next, we're going to do a mini mental status exam. Sir, can you tell me what country you're in?
United States.
Can you tell me what state you're in?
Georgia.
And can you tell me what county you're in?
Coffee.
Okay, can you tell me what year it is?
It is 2012.
Can you tell me what month it is?
April.
And can you tell me what day it is?
28th.
Okay, can you say these three words after me? Apple, car, penny.
Apple, car, penny.
Okay, can you tell me, can you spell world backwards for me?
D-L-R-O-W.
Okay, what were those three words I said again?
Apple, car, penny.
Good. I'm going to get you to identify two objects for me. What's this?
It's a watch.
And this?
Pen or pencil.
Good. Alright, I'm going to ask you to take this piece of paper in your right hand and fold it in half. Thank you. I'm going to give you this pen and let you write a sentence for me, okay? Good. Okay, now I'm going to draw an object, and I want you to draw the same object on the other side of the paper, okay? You draw it right there. Good. His mini mental status exam score was 30, showing he has no cognitive impairments. And that's the end of my headed to assessment. Thank you.